Pain or injury in the hand, wrist, elbow, or shoulder can make even simple tasks difficult. At Arkansas Surgical Hospital, patients have access to specialists who focus on restoring function and improving everyday life. Today, we're taking you inside a day in the life of Dr. Jesse Abeler, an orthopedic surgeon who specializes in upper extremity care from shoulder to fingertips. You'll see how his expertise and attention to detail help patients get back to using their hands and arms with confidence.
My name is Jesse Abeler. I do hand and upper extremity surgery. My specialty is shoulder to fingertip. I did my medical school in Denver, Colorado. Did my fellowship in Massachusetts at University of Massachusetts. A day in the life as far as what I get to deal with. A surgical day starts a little bit earlier in the hospital. Usually arrive here about 7 o'clock.
So every morning we come in and review the charts, make sure that we look at the H&P, make sure it's updated, and make sure that everything is accurate. Trying to make our record perfect with correct procedure every single time. So we're going to go say hello to the patient here. Well, good morning. You ready for a little surgery?
Yes.
Which finger are we working on here?
This one?
Okay, ring finger. I'm going to put a little mark on here. All right, I want to take care of the little band. So it'll be a little zigzag incision that goes pretty much right across there. Surgery probably about 15 or 20 minutes. So once we get you back there, it'll probably feel closer to 30 or 40 minutes for you, but I'll call you when we're done. Once we get you all positioned and comfortable. The surgery doesn't typically take too long. All right, give us just a minute. We'll get you to the bathroom, get you back there.
Okay, thank you so much.
Very good to see you. I'll call you when we're done.
It's a bit of a mental test almost every day, and so there are things that are very common and things that are very classic, but it's like the patients don't read the textbooks, so they don't know how they're supposed to present, and so it's always a little bit of a game to try to figure it out. Once you make the diagnosis, then the surgery is very much based on anatomy, mechanics, and so that's what I enjoy about that.
So they're about to roll in with the patient here. As soon as they're ready, we'll get going. So this first case, this gal has a trigger finger and a little bit of Dupuytren's. And so Dupuytren's is a contracture of the palm where her finger starts to draw upwards. And so we're going to take that contracture out and then release the first pulley on the ring finger. This will allow her better movement and be able to use her hand much more normally. All right, Micah, we are starting. Get that cord out, got the pulley released, and that is that procedure. Get a little bit of irrigation and a couple stitches. So that was a routine procedure, nothing out of the ordinary. That contracted band was just sitting underneath the skin, and so we take that out, and then that allows her hand to be able to open up more easily. The reason I chose upper extremity and hand specifically is because it's a little scary. There's a lot that's going on. There's a lot of complexity in the hand, and I kind of figured out that a lot of people don't want to do what a hand surgeon can do, and so that showed me that it would always have a bit of a demand. So this gal, she has a rotator cuff tear. It's kind of a decent sized one from the MRI report, so hopefully it's gonna we'll be able to pull it back and repair it down to what it needs to be. These kind of surgeries, in my experience, are done very well through arthroscopy, and so it gives us great visualization. So we'll go in there and see what she has and see what she can fix. All right, starting, Mallory. Coming at you. She had a pretty big rotator cuff tear. Her subscapularis, supraspinatus, and then part of this infraspinatus. And so we were able to get those tendons back down to the bone, and so that's going to restore the dynamics or the stability of the shoulder to the rotator cuff. It went as well as it could have, and it was kind of surprising. She had a really good bounce on her tendon, and so we were able to get it to pull back down to the bone. And so good repair. Sometimes it gets really scarred in. Wasn't that in this situation, so I think she'll do really well. What I would like people to know about what we have to offer in my practice, I think people are coming in looking for answers, and even if it's not the answer that they're hoping for, it's the answer that we can ideally walk them through. Sometimes a treatment requires surgery, sometimes a treatment just requires therapy and time, but I'm excited to take care of a patient, and I want them to know that. We'll do the very best that I can.
If pain or injury in your upper extremity is limiting your daily life, Arkansas Surgical Hospital is here to help. To learn more about Dr. Jesse Abeler or to schedule an appointment, visit arksurgicalhospital.com or call 501-748-8000.